Welcome to Live from HMPS 2026. We're here in Salt Lake City, Utah, and I'm delighted to be sitting down with Bridget Duffy. Bridget, welcome.
Thank you, great to be here.
We just met a few moments ago, but I have a feeling that we're kindred spirits around some of the things that we believe and think. So, would you mind, before we get started in our conversation, share a little bit about yourself, your background?
I am a crazy evangelist that thinks that I can actually try to humanize healthcare, and my focus has been working at the crossroads of technology and humanity, and I helped lead a movement around patient experience and improving that many years ago when nobody cared. Nobody cared about it until the government mandated we measure patient satisfaction and publicly report it. But what I learned quickly is you can't focus on the patient experience until you focus on the employee perspective and experience. And I realized we burnt out a generation of doctors and nurses and have overwhelmed them with technologies. So what I care about now is the role that AI is going to play in humanizing the patient experience, but easing the burden on doctors and nurses.
I love that perspective. I'm a big believer in the fact that the healthcare system is not as humane as it should be. And I'm not disparaging of providers and things of that nature, but it's interesting though that you and I have come to the same conclusion that technology could be a role to get there, and in particular this new nascent technology that has suddenly taken over everything, AI. So I want to hear your perspective on how do you feel AI can start to humanize what we're doing here?
Well, I think we've witnessed the mass exodus from the profession of nurses and doctors because of some technologies. So we have burnt out a generation of clinicians that are leaving. There's no shortage of nurses. They've just left the profession. So I think our opportunity now with AI is to get it right. And to bring in technology from before patients arrive till after they leave, that we have a checklist to say, is it safe? Can we trust it? And do we ease the burden of that technology on doctors and nurses? Do we take things off their plate? They're burnt out because so much is on their plate. So AI can be helpful in healthcare if it doesn't add to the burden of doctors and nurses.
So there's a couple threads there I want to pull on a little bit. And I'll go first on the productivity aspect of this, because I think a lot of people, that's what they're going fast towards, right? Is that AI is a productivity tool. We can eliminate some of the administrivia kind of tasks that we do in healthcare. You could set up an AI triage in the call center. You could start to have AI kind of help facilitate people that maybe are leaving the online appointment scheduling journey and bringing them back in, that sort of thing. But productivity doesn't always equate to value. Isn't that fair to say?
So true. So true.
So how do you square that with what we're doing? How do we determine where the right applications could be?
Well, personally as a physician, I'm starting to worry that healthcare has lost its soul, and will AI fill that void? I mean, there are studies showing that AI often demonstrates more compassion and empathy than actual humans. I don't think we can ever take the human out of the equation. The secret will be, how do we deploy AI that has a human around it, so that before patients arrive, the value is not removing the human being, but removing the friction from the experience. So once we remove the friction and ease the burden and actually demonstrate empathy through both the technology and the human, then you have a seamless experience in healthcare that is more productive, more efficient, higher quality, and less burden on both doctors and the healthcare system.
I love the perspective too that it's really about also easing the clinical interaction with that care. We talk a lot about that, the patient-doctor relationship and how important and sacred that is, but we've put a lot of strains in our current environment on preventing that relationship from really, becoming more fruitful. You feel that AI can really help to do that, whether it's through like ambient AI or other things, right? Tell us a little bit more about that.
Absolutely. Well, I've been part of a team through Vital creating an AI care standard, which is a checklist of 10 pillars of what needs to be in place to make sure that it's safe, it's trustworthy, that it is sensitive on how you receive information. No person, no human should find out that they have cancer from an app. I can't even tell you how often that happens. So we created a checklist to make sure that those things don't happen, and that we test it to make sure that it actually improves the workflow, taking burdens off of the doctors and nurses' plates. Right now, nurses only spend 2 hours of a 12-hour shift at the bedside. So could we deploy AI, for example, in an emergency room, where through AI, we're giving updates to the patient on their wait time? We're giving them results of their labs translated into a language they understand. we're monitoring their progress throughout the day instead of having to have a nurse come and do all of these things for the patient.
Yeah.
So I think it is using AI smartly for the patient's perspective, but also for the healthcare team.
Now, I've been an honorary recipient of the AI translating my labs and delivering that information to me, but unfortunately it sometimes delivers that information to me faster than my care team can actually react to that. It used to be the doctor would deliver the lab results with interpretations. Now AI is doing that. How do we feel that they are in the loop? How do we keep the clinician in the loop?
Well, that's why we've created this framework, because if there's a lab that actually says that you have cancer, or say that there is a pregnancy that didn't make it to term, or harm or unexplained bruises on children, you don't want the electronic record shooting that information out. AI can be used in a positive way to send an alert and have sensitivity in place so that it's routed to a human.
Right.
No human should get a phone call and be told to pull over to the side of the road and learn that they have cancer. AI can send alerts to your doctor. The doctor ought to be able to schedule an appointment with you to deliver difficult news. The day of having that information sent to you, I think electronic medical record companies are priding themselves on speed, but they're losing their humanity in how they deliver the information. And AI can fill that void. They can bring sensitivity and humanity to that encounter if the right prompts are built into that technology. And our framework and our checklists safeguards that and ensures that no AI technology should be deployed or built in a healthcare system unless you pass this checklist and get a score that shows that you actually do all these things.
It's like you're developing a standard for the industry.
We have created a standard, the AI Care Standard.
And that's really important to understand that, because a lot of times we have outside innovators coming in saying, like, we have these tools, we can apply them. I know all of the major Gen AI companies are saying, this is our, healthcare is number one target. They want to go after it. But we understand that a little bit better because we take into account not only the patient involvement, but also the clinician or the physician, the provider, whatever it might be that's providing that. I want to focus a little bit though on the patient themselves, right? One of the things that I've seen in a lot of recent studies is that patients, they trust AI, but they kind of don't really know what they're trusting in AI. And there's been a lot of conversation around transparency about utilizing AI in the healthcare experience. Tell me your perspective on that.
I think this is so important. There has to be transparency, and a patient or a mother of a child needs to know with whom they're interacting.
Right.
And it needs to be disclosed up front. I mean, even in other industries, if you call the airlines, you don't know if you're talking to a human or an agent. So, historically, nursing has been the most trusted profession in the world, year after year. And AI has the potential to be that as well, never replacing nurses, but the safeguards have to be in place that it's actually being used and deployed and fully transparent. Otherwise, we won't be able to trust the tool that you're using.
Absolutely. And guys, don't listen to the hype that the AI companies are saying. AI is not here to replace care, replace people within the care delivery. It's here to augment them.
Exactly. Like, for example, and this mentor of mine from 20 years ago, a pulmonologist, Dr. Ted Berman from Melina in Minneapolis, we were taking an exam on pulmonary, and the question he put up on the screen was, how do you know when to admit a child to the hospital that has pneumonia? A, they have a positive sputum culture. B, they have a high white count. C, they have a fever. D, the chest x-ray is positive. Or E, all of the above. And the answer was no. He flipped the slide, and we all said all the above. He said no. The answer is when they've lost the twinkle in their eye.
Oh.
AI cannot replace a human being looking at a sick child. We may get all the data sent to us through artificial intelligence about the labs, the metrics, but this human component has to be wrapped around all AI. So we will not be replaced. Medicine is an art and a science, and AI can augment it, but the tools have to have alerts that these things are positive, but a human should have oversight to the final decision that's being made about somebody's loved one.
I love that, Bridget. I love the optimism here. I actually believe that as well. So I appreciate that. Again, I found a kindred spirit in the space of technology applied the right way is going to actually help us humanize healthcare. Thanks so much for spending a few minutes with us today.
Thank you for caring about this topic.